Hello, everyone. Welcome back to the AABIP podcast. My name is Martin Salguero. I'm from Mount Sinai in New York. I'll be your host for this episode. Thank you all for joining us today, where we'll discuss some advices and tips for future IP applicants. Today, we're very lucky to have Dr. George Eapen join us. Dr. Eapen has been the program director for interventional pulmonology at MD Anderson Cancer Center in Houston for more than 15 years. Welcome, Dr. Eapen. Do you have any relevant conflicts of interest to disclose?
Well, thank you very much, Bertin. I really do appreciate your invite. It's an honor to be here, and I'm delighted that the ABIP is doing this, and you guys are doing a wonderful job at creating and maintaining this podcast, which reaches a lot of people, and I hope is helpful for a lot of people. I do not have any disclosures for this presentation. I don't have any disclosures for any presentations, to be honest with you. but I definitely don't have any conflicts, aside from the fact that I am a program director. And so naturally, I have an inbuilt conflict of interest with that.
Okay, great. Neither conflict of interest from my side as well. A reminder that these are our views of the speaker and mine, and not necessarily they're endorsed by AABIP. And with all of these formalities done, let's go ahead and get started. Wanted to start talking a little bit about the application process first. We all know that interventional pulmonology fellowship is something that pulmonary critical care fellows apply to. So they are familiar a little bit with the application process, but it has some particularities that makes it difficult, particularly for fellows that come from institutions without any IP faculty to rely on for guidance. But beyond procedural skills and scholarship, what are other things that program directors value from applicants?
That's actually an excellent question, and I also want to make my own disclaimer and say that these are my personal views. Okay, I certainly don't speak for all program directors, and I can tell you these are my personal views as to what I kind of look for. The reason I think this is a very interesting question is I've had the great honor and privilege of interviewing a number of IP fellowship applicants over the years, right? And a lot of applicants come in thinking that they really need to show off their procedural skills and things like that. And the fact of the matter is that coming to an IP fellowship, you don't need to come in as a interventional pulmonologist. You're coming to learn to be an interventional pulmonologist. So really what I'm looking for is, does this person have the raw material that is required to shape an interventional pulmonologist? And to me, by the time they come to an IP fellowship, they have had they've had a high bar to get into medical school. They've had a high bar to get to graduate from medical school. They've had a high bar to go into internal medicine residency. They've had a high bar to go into pulmonary critical care, and then to graduate from pulmonary critical care. So they've been tested multiple times already. So they're coming in. I know that they're very smart. I know that they're above average. They're 120, 130 IQ to begin with, right? I know that. I know that they're hardworking. I know all these different things about them, right?
Yeah.
So I don't need anybody to tell me that they're smart. That's a given. What I really look for is, do I feel that this person has a strong work ethic? Do they have compassion for their patients? Do they respect people around them, including, bronch techs, the nurses, everybody? Are they part of a team? Because to me, interventional pulmonary is a team sport, right? And so you have to be the kind of person who looks out for your team members, because you cannot win without them. And therefore are you somebody who can lead a team? That's really what I'm looking for. So do you have a sense of integrity? Do you have you have a sense of selfless service to others. Those are the things I'm looking for when I interview a candidate, because all the other things, that especially procedural skills, it tells me something about your work ethic, but that's it. So in other words, I don't need anybody to come in and tell me, oh, I've done 600 EBISs. Okay, great. You see what I'm saying? You'll do 600 more when you're doing your IP fellowship. You see what I'm saying?
Yeah.
And so that's what I think about that.
Yeah, so we definitely want like applicants feeling insecure that they don't have a high number of rigids or they don't have a fluoroscopy done. I think that definitely that's something everyone will learn during fellowship.
Yeah, absolutely. I don't think anybody should come in. I don't think anybody should come in thinking to themselves that, oh, I've never done a rigid or I've never even seen a rigid. Who cares? That is what we are going to teach you. You see what I'm saying? Absolutely. We will take you from scratch and we will teach you exactly what you need to know. And if we don't do that, we are terrible. So,
I understand. And I think that what you said, it's a perfect segue into the next question, which is, I'm guessing that the best way for you as a program director that is reviewing applications to evaluate this would be through letters of recommendation, right?
That is part of it. That is part of it. But increasingly, as you very well know, letters of recommendation have a significant selection bias. People don't ask for recommendation letters they ask for recommendation letters from people who are likely to give them good recommendation letters, right? So It's not a random sampling of that. So that's one limitation of letters of recommendation. Having said that, letters of recommendation do carry a lot of weight, because if, for instance, you ask for a recommendation letter from somebody who gives you a suboptimal letter of recommendation, that's a big red flag. You see what I'm saying? Because it tells me that you as the applicant don't really have an insight into what people think of you. You are under the impression that this person thinks you are amazing, which is why you ask them for a letter of recommendation, but they don't think you're amazing. That means you don't take feedback well. You don't understand when people are trying to tell you things during your rotations with them. You see what I'm saying? So letters of recommendation can be a big red flag. Now, superlative letters of recommendation are not as helpful. So in other words, the positive predictive value is not great, but the negative predictive value is very, very, very high.
I definitely see what you're saying. And regarding the content of the letters themselves, do you want to hear from comments regarding procedural skills? People talk about the research. What type of content do you want to see in those letters?
So it goes back to those characteristics that I'm looking for, right? I'm looking for work ethic. So work ethic can be demonstrated by, he did a research project, he did this, he worked hard, he extracted 6,000 patients from a exhaustive chart review of something. That tells me that the guy, maybe even if it was a stupid project, it still
he works hard.
He works hard, right? That tells me a lot about that. So that's it goes back to that. The other thing is, is he careful? So when you're talking about procedural skills and somebody says, he's very careful about how he takes care of patients and he doesn't. There are people who are overconfident. And they do things that they don't have the competency to do, right?
Yeah.
But people who recognize the limits of their competency, if that comes across in the letter, that's very helpful for me. So somebody who comes across, you're describing, their procedures. He's meticulous, he's thoughtful, he's careful, and he knows his limits. he or she. Right?
Yeah.
You know, I'm just going to use he as a thing, but it applies to everybody, right?
Of course.
That's what I'm kind of looking for, you know, and somebody who, you know, when the people are talking about clinical skills, you know, fundamentally we are pulmonologists, right? We are basically pulmonologists, right? And basically internists, even more, right? So what that means is that we don't have tunnel vision. We have the same internal medicine mindset that looks at things from a differential diagnosis standpoint, and we are in the process of ruling things out as we go along, right? So if that can come across in the letters, that's what I'd like to see. And that can be demonstrated by, you know, hard work, by research, and integrity by research, compassion, by how they take care of patients. All these things, if they come across, that's what I'm getting out of the letter.
Of course. And in a different way, you know, what would you like to hear from the applicants in their personal statement, like when they're talking about themselves and their goals?
What I want to hear from a personal statement is, again, it's an opportunity to demonstrate or to highlight what is important to you, right? As the applicant. Yeah. So a lot of times people people feel that a personal statement you have to have some sort of personal connection with, you know, the medical system for it to be an impactful personal statement. You know, not everybody has a story that is that compelling, a personal life story that is that compelling, right? I don't think that needs to. That's a necessary qualification for the job, right?
Yeah.
The job is to take care of people. That is what the job is, right? And so the qualifications for taking care of people is what you want to demonstrate in your personal statement, rather than this is who I am, right? Mm-hmm. Meaning, you know, this is my life story, this is my history. You're trying to get across, this is what I want to be. This is what's important to me. This is, you know, this is what my future is going to look like. That's really what I'd like to see in a personal statement. And then, you know, then we match that personal statement. What are your aspirations? What do you want to do? And there are people and actually remember, we have to remember that this is a matching process. Each program has strengths and weaknesses, right? So depending on what you want out of your career, a program may be right for you or not right for you, right?
Yes.
So what you want to do is be honest about what you want to do with your career, because that allows the sorting process. If I lie to you on my application about what I want to be, and you make a decision based on the lie that I told you, you're not doing me any favors. I'm not doing you any favors. Does that make sense?
100%. You want to make sure that you're going to the place that is right for you.
Exactly.
Yeah, definitely makes sense. And that's why it's called a match. Because, like, you know, if I always tell that I always have had the perception that you want to make sure that the goals of the program and your personal goals are matching. So there's no discrepancy of what, you know, the vision and the mission of the program and your particular mission of studying interventional pulmonology is as well.
That's exactly right.
Now, talking about the interview itself, how should the applicants be preparing for their interview, and what should they expect on the interview?
So here's what my thoughts are on that. First of all, research the program. Research the program you're getting an interview at, and find out what their interview process and style is, right? There are some programs that want you to do a presentation. There are some programs who want you to do some standardized tests of IP related test or whatever it is. So different programs have different formats for interviews, right?
Yeah.
Some people do a one-on-one interview. Some others do a panel interview. Some people, some programs, do all these things. So make sure that any program that you're interviewing at, you understand what their process is, right? And if you can, talk to people who have interviewed in that program before, either the people who were successful or even the people who were not. It doesn't matter, because they will be able to guide you through the interview process and what their experiences were during the interview process, right?
Definitely.
I think it's also imperative to research the people you are talking to. And again, a good program will send you an agenda beforehand.
Yeah.
So you know who you're talking to, right? Because here's the deal. I am not a big believer in information asymmetry, right?
Yeah.
Because anybody who's interviewing, any program who's interviewing you has your CV, has your personal statement, has your letters of recommendation, right? So they know a lot about you, right? You don't have as much knowledge about them as they do about you. Yeah. So you want to level that playing field as much as possible. So if you're interviewing with 3 different people, look them up. Look at their PubMed record. Look at the website that explains what they are, what they do in the program, and so on and so forth. So that when you come to the interview with them, you are not blind.
Yeah, definitely.
And then you can have a discussion with people much more coherently than if you had no idea who they are.
Yeah. As a former chief resident, for me, it has always been a red flag when people start asking you questions that are clearly on the brochure and are clearly on the pamphlet of information that you're giving them. It's like, if they didn't even care enough to read about your program, now they're asking you the same, like, how many weeks of vacation do I get? And it's like the first thing on the information. It's like, that's a gigantic red flag that this person does not want to go to that program.
Well, it's not even a question that they don't want to go to that program. It could be that they want to go to that program, but they are not people who are prepared. Yes. They are not people who they expect to be spoon-fed. You feel what I'm saying? So that is telling you what kind of person they are. Right?
Yes, definitely. I completely agree. And about choosing the right program, one of the things that it's becoming now new, and it's a big thing, it's ACGME certification. I'm seeing that all the programs are starting to catch up on becoming ACGME certified. But why should fellows care that the program that they're matching is ACGME certified, or where are they along the process for this?
So I think there is no question in my mind that going forward, the fellows should definitely care about their program, their prospective program being ACGME accredited. And I'll tell you the reason why. 2 things. One is that the accreditation, the joint accreditation process is going away, right?
Yeah.
By 2026, I think there's not going to be any more renewals of AABIP, AIPPD accreditation. Existing programs will maintain their accreditation with those folks until one of 2 things happens. It expires or they get ACGME accreditation, right?
Yeah.
So ACGME accreditation is going to be critical going forward for the board certification. That's going to be the only thing that qualifies you. You have to be in an accredited program. So until 2026, where the last of the programs will will complete their AABIP accreditation. After that, you're no longer going to be able to take the boards if you're not ACGME accredited. So that's one thing. The second thing is that it also tells you something about the program. So ACGME, you can argue that it is a very bureaucratic and perhaps an onerous process, right?
Yeah.
But what it does is it weeds out the uncommitted. So the program has to jump through a lot of hoops. The institution has to jump through a lot of hoops. So all of a sudden, you are identifying people who are investing their time, their effort, and their resources into getting an ACGME accreditation. That means they value the program enough. So if you cannot get ACGME accreditation, right, it is a signal to the prospective applicants that that program, for whatever reason, is not able to get this accreditation, is not able to jump through that hoop. Again, it goes to the signal that you get from it, right? The signal is not just they didn't get an ACGME accreditation, is they're not committed enough to try to get ACGME accreditation, or they don't have some essential component that prevents them from getting ACGME accreditation.
Yeah, definitely. It's kind of like a way to start seeing, I don't want to use a bad term, but kind of like a red flag of the program that perhaps there's something going on there that you should be very mindful of.
Yeah, I mean, to me, think about it. You've seen the arguments about board certification.
Yeah.
Right? There are very cogent arguments to be made that people can be good doctors without board certification. 100%.
Yes.
But at the same time, if you're a patient, right, and you have a doctor who's not board certified, right, what signal does that tell you?
It's going to make people feel uneasy about going to
Exactly. Exactly.
Yeah, definitely, 100%. And going along the line of making sure that you're choosing the right program, I know that IP fellows are all about procedures, and they're always looking at programs having the highest procedural volume. But what are other things in programs that are impactful and important that they should be looking for beyond just gross procedural volume?
So I think procedural volume is very important, to be honest with you. So procedural volume is very important, but there's a plateau for procedural volume. So in other words, if your program only does 100 EBUSs a year, that is not a good program, right?
Yeah.
But if your program does 4,000 EBUSs a year, right? That is not substantially better than a program that does 1,000 EBUSs a year. You see what I'm saying? I mean, there's a plateau at which point the value add decreases, right?
Yeah.
So procedural volume is very important. If somebody tells you that they're only doing 25 rigid bronchoscopies a year, that's a red flag. That's a red flag. Don't rank that program. You see what I'm saying?
Absolutely.
But at the same time, in between a program that is doing 100 rigid bronchoscopies a year versus 120 or 170 versus 200, that doesn't make any difference.
Yeah.
So I want to make sure that that procedural volume is important, but up to a certain point. Once you have that, that's kind of the basic, right?
Yeah.
That's kind of the basic. You want to look at what is the diversity of the procedures you're doing. So in other words, are you getting to do different types of procedures, right? Are you getting to see different types of patients? That's important, right?
100%.
And then the other thing, because if you think about IP fellowship, it is partly an apprenticeship, right? And so with an apprenticeship, you need the projects that you need to work on,
Mhm.
right? And you need the people who work on that project, the experts who work on that project with you, right?
Mhm.
So the more the number of IP docs you have, IP attendings you have in a
Mhm.
program of you, the better training you will get. Let me rephrase that. Maybe it's not necessarily the better training you will get, but the more diverse your training is going to be, right?
Yeah.
And therefore, at the end of IP fellowship, you are going to have to create your own practice, the kind of practice you're going to have, right?
Mhm.
And so if you've seen a rigid bronchoscopy done by 8 different people, right? And each person, everybody does a rigid bronchoscopy slightly differently, right?
Yeah.
And so you get to see 8 different styles of doing rigid bronchoscopy, right?
Mhm.
You're learning rigid bronchoscopy, but you're not tunneled into one particular way of doing rigid bronchoscopy. So that when you've seen the good and you've seen the bad of each person's style, and
Mhm.
you can amalgamate that, and you end up being better than the composite of all of them. You
Yes.
see what I'm saying? And that's the idea.
Yeah, and I think that that's one of the advices that I got for my application as well, is to kind of look at where people trained,
Yes.
because different origin of training, different universities of training is going to give you different ways of doing things, and you're going to have to learn way more techniques than by going to a program that only hired people from the same institution, so you're just learning the same thing over and over and over and over.
That is very correct. I think diversity of opinion
Mhm.
is really key.
Yeah.
So cross pollination always makes the end result much stronger than self pollination.
Definitely, that makes a big difference, I think, in the overall end result of training. Now, the last question I had about choosing the right procedure for you, it's something I noticed on the interview trail that there's a difference between some programs having their fellows spend the majority of their time with the bronchoscopy suite, or other programs trying to incorporate their fellows in clinic or the consult service. And goes along to what you said, that we're general pulmonologists and internists, but do you think that it changes the overall education of being just like the procedure fellow versus being someone that is part of an in-consult service for interventional pulmonology?
Yeah, I mean, I'll tell you, to me, again, this is just my opinion. I think that having the fellow be part of the decision whether or not to do the procedure,
Mhm.
what kind of procedure to do, what technique to use, what instruments to use, how to do the procedure, how to take care of the patient after the procedure, are all integral to the science and art of interventional pulmonary. So I am not a believer in the IP fellow is just the procedure jockey, and whatever comes in front of them, they just do it, and then that's it. I want them to be involved from start to finish. Now, I don't want them to be on a general pulmonary. I don't want them to be on a general pulmonary service because, if you look at general, at least my experience has been that if you're an undifferentiated pulmonary consult service, for
Mhm.
every 10 patients, you will have one real IP case, right?
Yes.
So I don't want the IP fellow to be taking care of asthma and COPD and all these different things. That's not what I'm saying.
Yeah.
But I think that the IP fellow should be on the IP consult service. So in other words, a triage service that has already weeded out all the general pulmonary cases,
Mhm.
and it is being considered for an IP procedure. But the fellow needs to be part of the ground floor on that. and should see it all the way through to the end. Because there's no point in an IP fellow placing a stent if they don't know how to manage the stent complications, or they don't know what the natural history of that stent is going to be. You understand what I'm saying? I mean, that to me, that doesn't make any sense. And I'm stunned whenever I hear about programs that have, IP fellows just in the bronchoscopy suite and nowhere else.
Absolutely agree with that. And people focus so much on the technical skill because, that's what you perceive to lack before starting your training. But I think that the most difficult part of a procedure is not the procedure itself, but everything before and everything after.
Yep.
And I think that that's the missed part by not being exposed to a consult service and following these patients during that part. Okay, Dr. Eapen, and do you have any last advice for the future applicants?
Yeah, so I think applicants should remember that the goal of IP fellowship, again, this is my opinion, the goal of IP fellowship, the primary goal of IP fellowship is really not necessarily to learn specific procedures. There are certain, you should have exposure to all the procedures that are currently available. But I think it's important to recognize that IP is a dynamic field. By its very definition, we are at the frontiers of everything that happens. When I finished training, there was no EBUS. Until 5 years ago, there was no robot. So everybody have had to learn these things as in their careers. And I have no doubt that there may be a nanobot or whatever it is comes up in the next 10 years, and you're going to have to learn that. So the point I'm trying to make is that there are three things that I think are important for an IP fellow to come out of their IP fellowship with. And that is situational awareness, good judgment, and the ability to take decisive action once you have the first two. So when I say situational awareness, I mean the ability to synthesize multiple different aspects, multiple different streams of information to decide what's important, what's not important. That's what I mean by situational awareness. The next thing is, good judgment. Okay, so I have all this information. What do I do? How do I do it? These are all decision points, right?
Yeah.
And then to developing that skill. And that only comes with seeing patients, practicing again and again and again, hundreds and hundreds of patients. This is what makes you an expert, right?
Yeah.
And then finally, you have to, in medicine by its very nature, is taking decisions with incomplete information, right?
Yeah.
So you cannot be paralyzed by indecision. You have to make a decision at some point in time or the other. And so getting that ability to say, okay, look, I have enough information. I'm going to make a judgment. And it's time to make that judgment now. That ability, these are the three things that I think IP fellows should come out with that confidence that they are good enough to figure out a situation that they've never seen before, right? And make the best of it.
Absolutely.
Remember that you are now at the apex of the referral chain. There is nobody else behind you, right? If you cannot fix it, there's no thoracic surgery there's no thoracic surgeon that can fix it for you, right?
Yeah, definitely.
You are it. Whereas in pulmonary, we still have somebody else that we can call. We can call IP or we can call thoracic surgery, But for you as an interventional pulmonologist, if you're not able to fix it, then nobody else can fix it. That's what I would say is keep that in the back of your mind. Absolutely. But it's a wonderful field. And I'm, the very fact that they have selected, that these very bright young people have selected themselves to go into this field is amazing to me. And I have seen, honestly, the quality of applicants improve and improve and improve. I don't know what's happening, but It is just amazing people that are coming through.
For the last report, IP was the most competitive subspecialty of internal medicine.
Yes.
Do you have any websites that we can recommend to applicants to get more information about the application or about IP programs?
Yeah, I mean, I think the AABIP has a list of the accredited programs. So that's a good resource, and some general educational resources as well. I think that the AIPPD has a link to the common application process, which the IPFAS Fellowship Application Service is a common application. And they have some additional details as well about the application process. I think, as I mentioned before, going to the places that you're interviewing at, going to their websites and seeing what they do and getting that's also a good thing. So I think those are the sort of the key things that I would suggest.
Fantastic. Thank you so much, Dr. Eapen. This has been a very rich conversation, and you gave us so many tips for applicants. We really appreciate your time.
Thank you very much for inviting me. I had a wonderful time. Thank you so much.